Today we will discuss serum creatinine levels. Basically, I will tell you how much creatinine level is equal to how much kidney failure is. In the beginning phases of CKD, no visible signs and symptoms are seen in the patient. The reason for failing kidneys is that the kidney does a lot of overwork to excrete waste products and extra water from the body, and due to this the patient does not feel that his kidneys are failing very fast. On the other hand, the body is also absorbed to manage the high level of toxins and high levels of water. How to measure kidney function? The very important test to measure kidney function is serum creatinine level test. The normal level of creatinine in the blood is approximately 0.6 to 1.2 mg per deciliter in adult males, 0.5 to 1.1 mg per deciliter in adult females. Now, if your creatinine level is more than 1.2 mg per deciliter, it means that your kidneys are not working properly. At the point when your CKD gets analyzed relies on when you begin encountering the signs and symptoms, because mostly people get the tests done only when the signs and symptoms start appearing. 1. Creatinine level is 1.5, then 75% of kidneys are working normally, 25% of the kidneys have failed. But when you feel good and no signs and symptoms will appear, this is the best time to start a homeopathic treatment. With homeopathic treatment, the level of creatinine can be reduced or stopped from the next progressing or slowing down the speed of its progression depending upon the patient. 2. Creatinine level is 2. 50% of the kidneys are working, 50% of the kidneys have failed. Now also many people have no problem in any way. 3. Creatinine level is 3.5. 25% of your kidneys are working, 75% of your kidneys have failed. Now the signs and symptoms are visible as anemia, renal bone disease and so on. 4. Creatinine level is 5. 10% of the kidneys are working, 90% of the kidneys have failed. Now the patient looks very ill. 5. Creatinine level is 6 to 8. 5% of kidneys are working, that means 95% of kidneys are failed. Now the patient is feeling very ill. This is the right time when dialysis is required or might be renal transplant is required. Many patients start showing signs and symptoms at creatinine level -2, and some patients do not show signs and symptoms at creatinine level 7. Patients generally ask questions that if your kidneys fail, then why are we still passing urine? Urine is made from two things, water and waste material. How much urine you pass only shows how much water is expelled from the body. It does not tell you how much waste material is expelled. CKD patients pass normal urine, but the amount of waste product is quite less in it. This is because waste products start accumulating in the blood.